we start, though, with the COVID-19 situation here in South Korea, which is worsening by the day. We are expecting to see the number of new daily infections remain around the 7,000 mark for the second day in a row. Now, given the sharp uptick in cases, authorities have again said they'll examine implementing stricter virus prevention measures.
For more on this and other related updates, joining us in our studio is a reporter, Shin Ye-eun. Good morning again, Yeun.
Good morning.
So it was just yesterday that we saw the highest number of infections here in the country. What are we expecting for today?
So Thursday's daily infections will probably be around 7,000 again. Up to 9 p.m. on Wednesday, we saw 5,114 new cases. This was 590 down from the day before, but the second largest number reported during this time frame.
So after yesterday's record numbers, we hear the government is looking at a new emergency way of trying to cope with this crisis, a circuit breaker of sorts. This would further strengthen the antivirus prevention measures already in place. Do we know when this might be rolled out?
At the moment, we do not. What we do know so far is that they are monitoring when this circuit breaker should be implemented. If you recall, at the beginning of November, authorities said they would introduce an emergency exit plan to halt the gradual return to normal scheme if the pandemic situation seemed to be too dangerous. Some measures discussed as part of the emergency plan included restricting business operation hours and gatherings at high-risk facilities. While an emergency plan hasn't yet been deemed necessary, authorities have introduced new measures to help with the crippling medical capacity problem. ICU beds for critically ill patients have been quickly running short. As of Wednesday, more than 84% of all beds in the greater capital area were being used, and nearly 70% of beds in other regions were occupied. For that reason, authorities said they would make treating patients at home an easier and more convenient option. The mandatory quarantine period for family members or those living with virus patients opting for self-treatment at home will be reduced from 10 days to 7 days as long as they're fully vaccinated. They also said financial aid would be given based on the number of people in each household, and oral COVID-19 medication will also be given to those in the high-risk category being treated at home from early next year.
Now, Yeun, the pandemic situation is worsening globally due to the appearance of the Omicron variant. Though we need to know more about this variant, as of now, what do we know so far?
Well, the WHO has given their backing to a very popular theory that Omicron seems to be more transmissible but less severe than other variants. Emergencies Director Michael Ryan said in an interview with AFP that preliminary data doesn't show Omicron to be a more severe disease than other variants like Delta. The organization's Director General Tedros Adhanom Ghebreyesus also cited studies from South Africa that found people who contracted the Omicron variant faced much milder symptoms than those who were infected by the Delta variant. He also urged governments to speed up vaccination programs and strengthen their virus prevention measures. Take a listen to what the Director General had to say on Wednesday.
All governments should reassess and revise their national plans based on the current situation and their national capacities. Accelerate vaccine coverage in the most at-risk populations in all countries. Intensify efforts to drive transmission down and keep it down with a tailored mix of public health measures. Scale up surveillance, testing and sequencing, and share samples with the international community. And avoid ineffective and discriminatory travel bans.
Now, it appears many governments are ignoring that last piece of advice from the WHO chief, but there we go. Some studies showing good news as well that the current vaccines we have on the market may in fact be effective against this Omicron variant.
Yes, you're right indeed. Pfizer has found that their vaccine could be effective. On Wednesday, they shared results from a laboratory test. A 3-shot course of their vaccine turned out to increase neutralizing antibodies by 25-fold compared to just 2 doses. This means that 2 doses might not be sufficient enough against Omicron, whereas a booster jab is. But a chief scientist from the WHO warned that we shouldn't make any hasty conclusions from this test. The scientist said that it was way too soon to determine determine whether reducing neutralizing antibodies meant the shot was less effective. The WHO is set to publish a review of its stance on the efficacy of booster shots against the Omicron variant within a few days.
All right, Ian, thank you so much for your report. We'll talk to you again on Friday.
Thank you.